Well, welcome to this talk. It's Wednesday, the 5th of January. Now, just a few orientation slides before we get down to looking at the UK and Australia and implications for the States as well today. Let's just look at some orientation here first of all. Now, just starting at the bottom here, Japan. There is a very small increase now in Japan, although Japan is still a bit of a mystery to everyone. So I've arranged an interview from Japan in the next couple of days, so we should have some enlightenment on that then, because there's just nothing in the mainstream media about why cases in Japan are so low. We know they're not testing much, but cases are genuinely low. Now, India, Omicron has just started in India. Now, that's going to spread throughout India. The implications of that, probably too early to tell, but it started. It started in India, 1.4 billion people. It's going to be potentially significant in India. It's just starting. Now, Israel, one of the more vaccinated countries, actually starting to roll out a fourth dose. Cases are going up now as Omicron starts in Israel as well. Netherlands. Now, Netherlands, interesting Netherlands. This wave here in Netherlands is Delta. So they've had quite a strict lockdown, got more or less on top of that. But now, this is just the very start, we believe, of their Omicron wave. So cases will be increasing dramatically in Netherlands over the next week or two, as indeed it is in Canada now. And look at Australia. Wow, I mean, what an increase in Australia, just dear me. United States, likewise, we saw the 1 million cases in the day yesterday, spreading still rapidly throughout the United States, and still got a good couple of weeks of spread to go in the States, and Australia likewise, depending on the part of Australia. But really dramatic Omicron increases. United Kingdom, again, this jiggle in the data here probably isn't real, but again, United Kingdom, Ireland, both highly vaccinated countries, and we see the immune escape, at least in terms of infection, or at least in terms of diagnosed infections, which turn up on these graphs as cases. It really is quite a dramatic graph. Now, next, I think we've got one on hospital. I know this next one's on variance. Now, 96%. Well, the UK is at least 96%, but this is catching up now. The United States again. United States is probably well into the 90s now, at least in most areas. And we saw yesterday that the cases are increasing dramatically in every state. This is all over the United States now. Japan, well, the few cases in Japan do seem to be on Omicron. So it just seems inconceivable that Omicron won't be spreading through Japan. I mean, why wouldn't it? It's spread through everywhere else. Stranger things have happened. We'll keep an eye on it, but hopefully some clarification on that later in the week. Israel, Omicron has, as we've seen, started. Canada, I think Canada's got much higher Omicron than that. India, this is based on very small numbers of samples. And Netherlands, as we've just seen in the graph, it's just got over a Delta wave with quite dramatic restrictions on social mixing. And now Omicron's come around as well. So that's just a little bit on the variance. Now, I think the next one's probably on hospitalizations. Yep. So Israel hospitalizations are low. Netherlands, they've coming down from that Delta wave now, which is good. Australia, they are increasing, as we've seen. Ireland, that's the island line there. Rather incomplete data in Ireland. Canada, hospitalizations are going up. Now, these lines look steep, but they're still not massive numbers. So that's for example, 100 patients per million. So if you think of a city of 1 million people, you're getting 100 hospitalizations. And from the data from the UK, essentially no increase at all in intensive care. In some of the countries, that is varying a bit. United Kingdom, so the hospitalizations, again, they've gone up dramatically. And there is pressure in areas of the health service now. But again, the pressure is largely due to staff sickness. Just people are off sick. something like 10% of the staff of the health service is off sick. Other areas, it is much higher proportions of people off sick. And I'm afraid the United States, we are seeing still high levels of hospitalisation. It is increasing, but it's been relatively high for some time in the States. They've just gone down from a high up there. And in the States, we have to conclude that there's more comorbidities. Now, there's plenty of obesity in the UK, but there's even more in the United States. I think there's a lot of nutritional factors in the United States where the diet is often not that good, which is surprising for an advanced, rich country like the States, but the diet is often quite poor in the States. Hoping to have more on diet shortly from the COVID symptom tracker data. Some very interesting stuff on diet, actually. So that is just a bit of orientation there. Now, I think I'll just show you a couple of slides from the Office for National Statistics as well. Because there's some really dramatic stuff coming out of here. Really dramatic. I mean, here's the first one. This is for the last week, up to the 31st of December, up to the end of the year. I mean, that is the Omicron increase there. Percentage testing positive, 6% of the country testing positive if we tested everyone in the country. But thankfully hospitalizations staying relatively stable, up a bit as we saw, but this graph puts it in a bit more context than that previous one, so that's good to see. Deaths again, no dramatic increase in deaths, so deaths about the same, hospitalizations about the same, cases up dramatically. And it's not as if the cases have just gone up, because the cases have been going up now really for some time, from mid-December. So this is not translating. This is not translating into high levels of hospitalisation and high levels of death. Slightly increased, yes. High levels, no. In terms of vaccine in the UK, percentage who've received 3 doses of vaccine now 45%. 4 in 10 adults more than have had 3 vaccine doses. This is going to prevent a lot of hospitalizations, of course, as we know. And I use that term advisedly, as we know. We do know this is going to reduce hospitalizations. Probably not going to reduce systemic infection, symptomatic infections that much, but it's going to reduce the severe illness and hospitalizations. We know that. 9 in 10 adults had antibodies, well, over 95%. So very large amount of antibodies, and yet still getting symptomatic infections, still getting asymptomatic infections. The infections and the symptomatic infections are breaking through the antibodies because of the immune escape. And then this parameter, the ONS use, social mixing, stayed about the same at 40. So that's from the Office for National Statistics, as is this. Now, what we have here is Omicron and Delta. So let's look at England first of all. Well, obviously Omicron has increased, but Delta has decreased. And this is the projection now that it's decreased even further. The projection now that it's going to increase even further in terms of Omicron. Now, the Office for National Statistics have actually brought this data out a couple of days early, so they do stress it's incomplete, and they will be updating it on Friday. But it's good that they are keeping bang up to date. This really is quite impressive the way they've adapted to this. So England, Omicron up, Delta down, and we can't stress how important this is enough. We do see that the Omicron is displacing Delta. It is outcompeting it, and it is displacing it because the numbers of Delta cases are going down. It's really quite encouraging. And there's the key on top, comparable with Omicron, comparable with Delta. Wales, we see a similar pattern, Omicron up, Delta down. Northern Ireland, similar. Scotland, similar. So this is all over the UK. We're seeing this really quite encouraging trend. Now let's just look at some of this data because it's so impressive. And the same is happening in the States. The same is going to be happening in the Netherlands pretty soon. The same is happening in Australia. The same is happening in Canada. This is happening all over in Ireland. It's happening. This is happening all over the world. Areas where it's not happening now, it will be soon. We can't stop Omicron spreading around the world. All we can do is slow it down a bit. So Office for National Statistics, Quite incredible, really. Estimated 1 in 15 people in England had coronavirus infection in the last week up to the 31st of December, and this information was just released today, 5th of January. So 1 in 15 people in England actually had the infection in that 1 week period. This week into January, it will be higher, perhaps 1 in 10. Next week, it'll be higher still, I would estimate. Then it might well start to go down. It's going to go down in about... This is going to go up for the next week or two, then down for the few weeks after that. There's no real doubt about that, because it's just spreading around everyone. It's as if the Omicron is burning up all the fuel that's available in terms of people that are susceptible. But of course, as it goes, it's leaving huge amounts of community and herd immunity in its wake. It's just great. It's good that we're generating so much herd immunity, community immunity, or whatever you want to call it. We always used to call it herd immunity. I used to teach the students herd immunity, but we seem to be calling it community immunity now, but it's the same thing. 1 in 15 people in England would have tested positive if we tested the whole country. London, it was 1 in 10. Some signs that it's going down a bit in London now. Some signs it's going down a bit. Or levelled off. It could go up again, but we simply don't know. There's some signs that it's levelled off. Southwest of England, which was the lowest, even in the lowest part of the country, there was still 1 in 30 people infected in that week. This is not telling us whether they're symptomatic. This is based on antigen. This is based on antigen testing and extrapolating to the whole country, but in a very scientific way. So England, 3.2 million people infected, 1 in 15. Wales, 157,000 people infected, 1 in 20. I mean, that's just in 1 week. 3,270,800 people infected in the 1 week. It's just really, clicking the wrong one. It's really dramatic stuff. Northern Ireland, again, similar, 1 in 25. Scotland, 1 in 20. So we noticed that England, England 1 in 15, slightly lower in Wales, Northern Ireland, and Scotland. So have the limited restrictions that they've introduced here helped to slow it down a bit. It's not going to stop everyone getting it, but has it slowed it down a bit? Perhaps a little bit. Not much, a little bit. Now, deaths fall in England and England and Wales. Now, the data for Scotland and Northern Ireland won't be out till this Friday, but we can expect it to be fairly similar. Week ending the 24th of September. So deaths are actually going down. So week ending the 24th of September, the last time there's deaths available. 591 deaths from COVID-19 registered. 1 in every 22 deaths, 4.5%. So 519 deaths in that week. The week before, from COVID-19, it was 755 deaths, 6.1% of all deaths. So down quite nicely. Can we say that Omicron is reducing, as Omicron spreads, it's reducing the number of deaths? Not quite yet, but we can say there is a temporal correlation. Interesting. Now we're going to get a report from somebody in Australia. So over to Dr. Summerdy now. Thank you very much, Summerdy, as always. We always look forward to your reports.
Hi, John. I'm Dr. Sumati Mahen, a general practitioner from Sydney. I'd like to give a short update on the Omicron in New South Wales. Over the past 2 years, we fought off all the variants of COVID with a strict lockdown and closed borders, which helped us to keep the death rate lowest in the world. Then we fought the Delta strain with the highest vaccination rate and the COVID rules, which was very effective, even controlling the infection. Since last 2 weeks, we have moved from the lowest rate of new cases to the highest rate per capita of new cases in the world. That's another record good or a bad reasons. Now we have joined the world platform with Omicron virus. In Sydney, we recorded a first known case of Omicron on the 3rd of December 2021, a community transmission, this time a school student. Here a quick look at the graphs. The new cases, New South Wales, Australia. You can see a small hump, which is the Delta wave. And you can see a rapid spread, almost like vertical, that's Omicron. Since last 2 weeks, cases are exploding without any discrimination. These numbers are tip of the iceberg. Definitely the numbers are much higher, 5-fold increase because of the case positivity rate. Our case positivity rate is 21.4%. Usually in the past is less than 1. This tells infection in the community is much higher and spreading very fast. People were not able to get the PCR test done because you have to stand in a queue for several hours, and to get the results it takes days. Even we do the PCR test, our lab is overwhelmed, could not cope up the load. That results delay in delivering the results. So our government introduced a rapid antigen test, those who have contacts without symptoms. Let's see the next slide. Daily new corona cases in Australia. As you can see again, it's a bit Delta variant and again rapid rise in Omicron. This is follows similar curve compared to New South Wales. Here the graph of hospitalization, intensive care and on ventilator. Within the hospital admission, only a fraction of the positive cases, 0.9% in the hospital, and around 50% of them are incidental findings. Even the small proportion of cases in the hospital, but small proportion of the large number of cases, still a large number. More than 60% of the COVID admissions are under 40 years of age. 25% of those needing intensive care admission are also under 40 years of age. Most of the intensive care admissions are Delta variant and unvaccinated patients. ICU admissions are very small, and ventilators, as you can see, a tiny thread line is very, very small. This is a similar slide in a different format. As you can see, the hospitalization rising, and this is an intensive care admissions, and the grey line is the ventilators. New South Wales COVID death rate. There's a huge hump here, that's the Delta wave, and this is Omicron. We have a first death on the 27th of December due to Omicron. And we have 7-day average is 3 deaths. There's a current management plan outlined by our Chief Health Officer of New South Wales. We call it a balanced approach to the surging number of cases in New South Wales, while pathology labs are still catching up on testing. So we introduced the rapid antigen test, RAT test, for those close contact without symptoms. We also changed the definition of a close contact. The definition, if you spent more than 4 hours with a positive person in a household or residential setting. Close contact and people who test COVID positive will now need to isolate for 7 days only rather than 2 weeks. This is to keep the work balance as well. We are in a better position to defend this wave. New South Wales has the highest vaccination rate as an advantage. currently in the warmer summer season with plenty of vitamin D, and we have COVID rules still in place. We are giving a booster dose program. Also, the government have planned to start the vaccination for the 5 to 11-year-old group since January 10, 2022. What will happen to Omicron in Sydney? It's a multiple choice question. Several answers, several possibilities. Will it stay with us endemic? And our children going to be the reservoirs? Will it evolve into the new variant like in France? Will we get herd immunity? Will it act like a polyvalent vaccine? Will we develop long COVID? After all, this illness is not totally a benign illness. Will it be the extinct pathway to COVID-19? And many more possibilities. In my opinion, catching the virus is inevitable. It's a matter of time. It's spreading very rapidly within the community. We will get herd immunity, and Omicron will go extinct from Australia soon. This is my optimistic thoughts. Thank you.
Excellent, Sumadi. Thank you so much for that. Am I back on? Yes, I am. Right, let's have a go at the multiple choice that Sumadi set us there. Will it become endemic? Yes, for the next few seasons at least it will. Is there going to be a new variant? No, I don't think there is, because Omicron will outcompete just about everything we could imagine at the moment. Is there going to be widespread herd community immunity? Yes, I believe there is. Does Omicron act essentially as a polyvalent vaccine? Yeah, it does. I think it does. So I will be... it looks like Australia's got it right again, actually. It really looks like it's got it right again. And the people that are sickest are Delta. So remember, Australia is finishing off with Delta, starting up with Omicron. So from memory, 72% of the people in intensive care in Australia are Delta, not Omicron. So as more people get Omicron and that displaces Delta, we would expect that to start going down. That would be the hope. Sad to see these younger people there, and it is the unvaccinated that are getting sickest. Okay, I think that's nearly us for today. Thanks so much for that, Sumadi. It's we did do something on Australia yesterday, but it's good to get it straight from a doctor on the ground in Australia. Right, Marnix is sent us a report from Netherlands. He says they're currently recovering from a big Delta wave, which we knew that, so that's a pity, and we saw the Omicron wave now starting. ITU capacity had been threatened in Netherlands with this Delta wave, but they got it down with this lockdown. But now the Omicron hopefully is going to come to the rescue. They were locked down for quite a while. There's been a lot of fear of Omicron that may turn out to be unjustified. Hospitalizations have decreased dramatically just recently in the Netherlands, but now seem to be flattening. And he says, as I explained, Omicron wave is inevitable. There is going to be an Omicron wave. My question is if you think that it makes sense to have lockdowns. Well, that's a good question. This is the email here. Yes, we need restrictions for the time being to slow down the spread of Omicron so that we can spread out any rushes on hospitalisation. But I don't think it's happening. I think Omicron is so transmissible, it's just going to romp through the whole population in the next few weeks, in Australia, in the UK, in the United States. So ideally, we would slow it down as much, and we should. I'm not saying throw in the towel, forget it. We should slow it down as much as we can, and follow all the regulations. We need to slow it down as much as we can, but I don't think we're going to be very successful in significantly slowing it down. Now, the positivity in Netherlands at the moment is 30% positivity rate. Again, as somebody said, indicating a very high transmission rate. And finally, Ron asks a question about when you're most contagious. He he thinks you're most contagious 2 days prior to the symptoms and then 7 days after symptoms. So that's about right, Ron. We've looked at this before. If you imagine that's day 1 when you get the first symptoms, and that's the time before that, and that's the time after that, then you're going to be infectious. If they're blocks of days, you're going to be infectious a couple of days before you get symptoms. And you're going to be very infectious the first day, quite infectious the second day, probably fairly infectious the third day. But after about day 8, your chances of transmitting the disease on will be fairly negligible. So you're most infectious in 2 days before and about the 3 days after. Then it gradually goes down to about 8 or 9 when, after day 8, transmission is going to be essentially negligible. So that is roughly what we're getting. So people are most transmissible when they first get symptoms. But of course, we know that some people don't get symptoms. So we know that there is asymptomatic spread of Omicron. And of course, we know, as it's been true all the way through this pandemic, that there is pre-symptomatic spread. Now, I'm just going to give a slight teaser for something else I've been working on. Let me just show you a quick slide before we finish. Now, this is a phylogenetic slide. So this is the original strain of the virus here. And then that mutated into the Delta type of variants. So this is Delta, this is the Delta line here, and these are Delta subvariants. It also mutated into the Gamma, which we didn't see much, the Beta, which we saw in South Africa, the Alpha, which of course was the UK Kent variant. So it's mutated into all of those. But what we see is we had the whole world full of Delta for months and months and months and months and months. We had the whole world full of Delta, which displaced Alpha. And Delta displaced Beta in South Africa. And the Omicron has not come from Delta. It's come from near the original Wuhan virus. It's most like the Wuhan virus there. So Omicron is most like the original Wuhan virus. But it hasn't emerged from Gamma because basically there wasn't any anymore. It hasn't emerged from Beta because, again, there wasn't many of that. It hasn't emerged from Alpha because that was superseded by Delta, and it hasn't emerged from Omicron. So, the Omicron has not emerged from Delta. So the question is, where the heck's Omicron come from? Well, it's come from near this wild type, but what happened all along here? So where has Omicron come from? And the answer is it might have come from mice, but we're going to do that in the next video. So thank you for watching this one.